Hi everybody, I'm Dr. Praful. I'm the foot and ankle specialist at Yashoda Malakpet. I'm here to tell you about few common problems which we see in the foot and ankle region. Great toe deformity, which we call bunion. When we say deformity, if you see in this foot, if we consider this as a great toe, your toe would be turned inwards and you'll have this part having a outward protuberance area, which we generally see in elderly people with rheumatoid arthritis, or sometimes in young population also when they use a prolonged tight footwear, and some other times it can be because of the traumatic conditions also. Now this part, which is outward appearance of the foot or the toe which is going inwards, can be corrected with minor orthotics, or it can be managed very well with conservative managements as well. But if we have a prolonged negligence of this condition continuing for long time, it may cause for permanent deformity and it requires a minor surgical procedure to be corrected. So if you are suffering with this kind of a deformity, I think it's better to consult a foot and ankle specialist and get it corrected at the earliest. Pain in this part, this we call of the ball of the toes, this area. So at this area what happens is this foot part, when we put weight on this region, you'll have pain in this area, which we call metatarsalgia. It can happen mainly because of the improper fixation of the traumas or neglected fractures, or sometimes it can be because of the improper walking or prolonged walking with improper footwear, and sometimes in the soft tissue conditions as well. These conditions can be very well treated again by conservative managements, by where we correct this deformity and get this metatarsalgia out of the way. Sometimes if it is again neglected or have been prolonged negligence of these conditions without showing to a specialist, it requires a surgical procedure where we have to correct this bony architecture and get it back to the shape. As we know, in the present population, diabetes has been increasing. With this, diabetic foot problems are also increasing. Common thing what we see in diabetic foot part is the blood supply to this region, this midfoot region, gets hampered, and the nerve supply also gets hampered. Thereby the individual won't be having any sensation in this foot area. So whenever there's a minor trauma or anything happens in this region, it goes into the negligence mode where the patient without knowing, he may just keep on going for repetitive trauma in this region because the nerve supply has been damaged, and this bone also goes for destruction. This we call as a diabetic foot. This again can be very well treated by conservative managements, by good control of the diabetic condition and sometimes good orthotics. But inevitably in this diabetic condition, diabetic foot condition, they require a correction of this foot. Thereby we offload this foot area from the soft tissue, and soft tissue can be avoided to have any ulcers. We generally see in a female gender population, generally in elderly people, or sometimes in middle-aged people also. This is like pain appearing in this area, in this downward aspect. It is mainly because of we have a fascia which connects from here to here, like this. So when this fascia gets inflamed, it can be because of many reasons again. It can be because of the lack of exercises in this foot muscles, or it can be tightness of this fascia because of some inflammatory condition like arthritis or diabetic conditions also can be seen. So this again can be very well sorted by conservative exercises and minor footwear modifications. In very rare conditions, sometimes even after prolonged rehabilitation or prolonged exercise therapies, the pain is not reducing. We go for minor procedures where the pain has been reduced and daily living activities can be proceeded upon. These are the most common foot conditions which we find in the present population. TA, tendo-Achilles. As we know, tendo-Achilles is a calf muscle tendon which connects from here to here. It is mainly for doing this movement of the joint at the ankle, and this one again gets inflamed because of many conditions, mainly because of degenerative as age goes by. This again can be very well addressed by simple regenerative medicine therapies or sometimes by exercises, and if in very rare conditions, if they are not supportive of this, we go for minor surgical or moderate surgical procedures where this pain can be very much corrected off. So these are the, in a brief, these are the common conditions which we see in the foot and ankle region, which again can be very well addressed by conservative management if you consult a foot and ankle specialist at the earliest and get it corrected as soon as possible. Thank you.
Like, comment, and subscribe for more health updates.